Hi all, let us look at the neonatal resuscitation guidelines which are updated in 2023 and are endorsed by AAP and AHA. So these guidelines, they have update in two domains. One is for umbilical cord clamping and the other is for positive pressure ventilation. So in umbilical cord clamping, they are saying whenever there is a term or a late preterm more than 34 weeks of gestation, then we should be going for delayed cord clamping, which is for 30 seconds. For a term and a late preterm infant more than 34 weeks of gestation who do not require resuscitation, then there is no role of intact cord milking over delayed cord clamping. So these two concepts I'll tell you. They are saying that delayed cord clamping we know is for 30 seconds. So obviously if the baby is stable, not requiring resuscitation, then only is the point of doing delayed cord clamping, right? So in the case when the baby is not stable, you have to go for intact cord milking. You don't have to wait for delayed cord clamping. Now here for a non-vigorous term and late preterm, obviously the baby is non-vigorous means requiring resuscitation, then we will not wait for delayed cord clamping, we'll directly go for cord milking. Now it's safe for a preterm born at less than 34 weeks of gestation who do not require resuscitation. So we know whenever a baby who does not require resuscitation, we will go for delayed cord clamping. There is no role of intact cord milking when the baby can be given delayed cord clamping. Just remember this concept and it's done. Now for a preterm infant between 28 to 34 who do not require resuscitation but delayed cord clamping cannot be performed, then we'll go for intact cord milking. So delayed cord clamping cannot be performed could be the reason when the placenta is separated. Alright, there is no point in waiting for delayed cord clamping. One important update is less than 28 weeks. Remember, intact cord milking is contraindicated. It is not recommended. Reason is there will be increased risk of IVH in these babies. So that is why we do not do intact cord milking in less than 28 weeks. More than 28 weeks, any baby who is non-vigorous, we have to do intact cord milking over delayed cord clamping. The next update is for PPV. Effective PP is priority in newborn infants who need support after birth. Using TP's resuscitator to deliver PPV is preferred over self-inflating bag. That means the ABO bag. Now they are saying because both TP's resuscitator and flow inflating bag require a compressed gas source, then you should be having a self-inflating bag also. That means the ABO bag. It does not require a compressed gas source, and at least room air gas can be given to the baby if we don't have a compressed gas source. And the next update is use of a supraglottic airway may be considered as a primary interface to administer positive pressure ventilation instead of face mask for a newborn infant delivered at more than 34 weeks of gestation. So these were the updates. Hope you find it useful. Thank you so much.